Approaches to Solving the Talent Crisis is hosted by Community Foundation for Southeast Michigan. Please welcome President and Chief Executive Officer of Henry Ford Health, Bob Riney.
Good afternoon, everybody. You are here instead of out on the porch. We are so happy about that, and that means that you care a lot about talent, you care a lot about the workforce of the future, you care a lot about education, and you're problem solvers. Because you're here for a topic that's going to touch on all of those things. So we're really grateful that all of you have joined us. I've got a few in the peanut gallery over to my right that I'll be watching, and they know who they are. But thanks for being here today, and thanks for the Community Foundation of Southeast Michigan for hosting this important conversation. And it is intended to be a conversation, and we have some great panelists that are really going to show the spirit of collaboration among industries that compete. Because we have to compete and collaborate if we're going to solve big, vexing problems. And we can do both. A lot of people think it's one or the other. That's the wrong way to think. We can compete on things we should be competing on, but we should collaborate on things that are important to us. And talent in Michigan is one of those things. I'm thrilled to just make a few kickoff remarks before we turn it over to this great panel. But you know, this is about collaborating at the end of the day to build strong, healthy communities. And our team at Henry Ford talks a lot about population health. And that our job, our mission, is to improve the health of the communities that we have the privilege of serving. But guess what? Direct health care, hospital stays, all those things that are vitally important are a relatively small piece of what determines whether a population is truly healthy. Economic health, education health, job access health are all key ingredients, safety, to really population health. So we take our mission really broad. We know what we're specifically great at delivering, but we take a holistic view to our mission because it's a holistic view that's going to solve vexing problems. And this is one of them. We need a strategic long-term solution to addressing the shortage of healthcare professionals, and what I might add is professionals in a lot of other industries as well, but today we're going to focus on healthcare. We have had all sorts of wonderful support in helping the industry with its chronic workforce shortages. And we've done all sorts of workforce design and redesign to help retention of talent. But it's all been somewhat incremental, not intentionally so, but incremental. And so what we find ourselves is like on a hamster wheel. You know, we're solving 2% of our nursing shortage instead of 80% of our nursing shortage. Or we'll get another energy and another issue going and we're solving 5% of that nursing shortage instead of the 80%. And so when you are in high stress jobs to begin with, and you're in an industry and in a job classification that experiences chronic shortage, incremental doesn't actually solve the problem because you're burning out, because you're constantly reorienting, retraining, or working with new team members. And healthcare is a team-based sport to deliver it in the most effective way. So we're trying to change the conversation and change the approach to, instead of thinking incrementally, as well-intentioned as all the community colleges are, all the universities are, all the various health systems are, to take kind of a business-led approach to problem solving. And a business-led approach in the way of thinking really about how do you get in front of this problem as opposed to constantly trying to play catch-up. And so picture an example of what happened with Stellantis in the past when they were going to open big presence in Michigan, but they said we can't go forward if we don't have the confidence that we can get 4,000 qualified workers that'll be engaged, that we believe have staying power, then we'll move forward. And so they didn't go to 90 different places and said, how can you help? They convened a body that said, we will work with all the different folks that can help solve this problem and bring you what you need, business, 4,000 talented people. We need to approach that in the healthcare industry in the same way. Us as individual systems all trying to outmaneuver one another to get talent that is too small of a pie versus enlarging the pie is a fool's game. And I'm not saying that we're fools. It's just a result of trying to be in constant problem solving, putting out fires. And so we've challenged a team of talented individuals to help us solve that, to let us leapfrog in a collaborative way to solve this problem using all the stakeholders. Many of you who are in this room are vital to this, but instead of creating competition at problem solving, creating collaboration on solving. And we have the Detroit Regional Workforce Partnership, we have the Detroit Regional Chamber, we have a number of entities that have been working on a collaborative model and getting some results, but the healthcare industry hasn't necessarily come to the table as a unified voice in the past on these issues either. So Corewell and Henry Ford Health have agreed to take a lead on this collaborative model, but we are going to be inviting all the health systems in Southeast Michigan to participate in helping us really create a talent pipeline while we all work on how we make sure that we're providing the environments to help people thrive, find joy in their work, and sustain. So as Jan predicted, I looked at my notes 1 second and then just went off covering what I wanted to. But it's really from the heart of what I really see and what I really want. So today's panel is going to exemplify the collaborative spirit that's required to really address this talent crisis. As they share ideas and insights, I'm going to urge everyone in this room, think boldly, think creatively about how we can work together. That does not mean that we can't have our own unique ideas or our own unique angles. That's what we all do as we run organizations. But contributing to a much bigger need in an organized and transparent way. We also want to make sure that our talent workforce of the future is equitable in access and that all communities find a pathway. All communities find a pathway. And that's not just the obvious distinctions in communities, but even the subtle ones that we want to make sure are part of the story. Healthcare is an absolutely wonderful enterprise. I would not have spent over 4 decades in an industry that I don't love, and I absolutely love this industry because of everything it provides and everything it meets unwanted needs and takes care of people at their most vulnerable moments. But having said that, I've lived through 4 decades of nursing shortages. Just to give you an example, 4 decades of nursing shortages means we haven't solved the problem. We are in perpetual catch-up. This is an opportunity to leapfrog ahead and create a Southeast Michigan that attracts, nurtures, and retains the best talent. We can be part of the Michigan growth solution, and that makes us a destination for care. Boston established itself as a mecca years ago for attraction of healthcare talent and education talent, and I'm competitive. So we can collaborate as a group, but we can beat other communities' butts and really become that destination for talent by what we're able to do together. So thank you, and I'll turn it over to the panel.
Please welcome Vice President of Education and Talent for the Detroit Regional Chamber, Greg Handel. Senior Vice President of Talent Attraction for Corewell Health, Jan Harrington-Davis. Director of Talent Solutions and Strategy, Workforce Diversity, and Workforce Development for Henry Ford Health, Catherine Susko. And to moderate the discussion, please welcome Executive Director of the Detroit Regional Workforce Partnership, Jayme Powell.
Good afternoon. We can do that a little bit better, right? Good afternoon. Good afternoon. Thank you. Well, wow, how do we kick off this session even better than Bob Riney? Everybody, let's give him one more round of applause. We are so incredibly grateful, not just for your opening remarks, but for your leadership in Southeast Michigan. So thank you so much. I'd like to begin with, on your table, some housekeeping, are some question cards. So if you do have any questions for the panelists, please feel free to write them down, and the chamber team will come around and pick them up shortly. And so, hi friends.
Hi.
Hi. I want to begin by acknowledging our session sponsor, so the Community Foundation for Southeast Michigan. We're really grateful, Rick DeVore, our president and CEO, Nicole Sherrard-Freeman, our chief operating officer. We are so incredibly grateful for your commitment to a thriving region and including the Detroit Regional Workforce Partnership in that vision. So thank you so much. Before we get started, I'd like to see just a show of hands. So who in the audience has a grave responsibility for recruiting talent to your region? Wow, incredible. There's a lot of responsibility that this group carries.
Yeah, no pressure.
So thank you so much for being here. I'd love to get started by hearing from you personally why this topic is so important to you. Greg, let's start with you.
Sure, well, I want to start by saying we put our money where our mouth is in our family. So my mother and my sister were both nurses in the Henry Ford system. So start there. There's nothing more important to the future prosperity of our region than solving this issue. A region runs on talent. We've heard Mary Barra say in the last couple of weeks, the jobs go to where the talent is. This is not a generation or two ago where people move to wherever the jobs are. If you want to thrive, you have to develop the talent pool. So there's just nothing more important than we can work on.
Couldn't agree more. Jen, how about you?
Well, I think Bob led us into a great discussion around this area by saying that as the top or largest healthcare organizations within Southeast Michigan, we have to get out of the space of competition and to collaborate. And so I think he said it best by saying that. And with this group, we are forging to do so, right? So that would be one thing. Another reason why it's important to me is because the talent of today and tomorrow represent my family members, right? My cousins, my sister, my brother, people that live in the Metro Detroit area. And so the ability to educate them far beyond where they think they can be, right? And to be able to give them possibilities for not only a job, but more so a career, right? And so that's where all of my power comes from. Because I know people that don't know what they can be. And I think we as a group, together, collaborating, we can fix that. And so that empowers me.
Couldn't agree more. What about for you, Catherine?
I'm going to piggyback off of Jan in the family sense. And, my kids play a huge role in inspiring change and wanting more for them. But when I look at the privilege we have in the communities that we serve, it's really about providing community. It's about building community. It's about developing and offering advancement opportunities. Even looking at generational changes over the last 40 years, knowing that we're going to change faster as we move forward. So thinking differently, creating new opportunities, and really collaborating in new ways that allows us to keep up with change is huge for me. So being able to really build on working alongside each other to grow our communities actively is probably my biggest motivator in this space.
Well, we've definitely got a powerful team up on the stage here today. So thank you for that. And so as we segue into the meat of the conversation, I thought it might be important to lay the foundation for an important and fairly staggering statistic, which is that there are about 500,000 working age adults in the Tri-County region alone who are totally disconnected from the labor force. And so, Greg, starting with you, I think it'd be very difficult to find anybody who's been at regionalism longer than the Detroit Regional Chamber. So would love to hear how the chamber defines regionalism and why should we all care about it?
Sure. So, I mean, the reason we have to look at it that way, that we have a CEO Talent Council that informs our work. Peter Quigley from Kelly is our chair. And employers look at our region as one labor market. They don't look at it as a bunch of, disparate little municipalities. They look at this as one labor market, if it's not a national or global labor market that they tap into. And if we look at the labor market in our region, one of the things that the chamber does is we put out a state of education report every year. One of the things we track is, so what does the talent pipeline look like? And we look at what happened. So students that entered high school 10 years ago. So the most recent cohort we could study was 2013. If you look at every 100 students who entered high school, you look at how many ended up 10 years later. So after 4 years of high school, 82 of those students graduate. You look at how many of those matriculate into higher education. You look at how many end up with some kind of a credential 10 years later. It's only 35 out of 100. And that's a region with, 9 counties. We have 5 community colleges in this region. We have over 100 school districts. We have 4 large public universities. We have 6 Michigan Works agencies. There's no way to tackle that problem of that talent pipeline and the leaks in it without creating a table to bring all of those partners together. So, there are great things happening here and there, but how do we bring all those partners together to figure out what's working, scale what does, figure out where the gaps are, and how to fill those without looking at this at a regional level and trying to tackle that head on that way.
Jan, you represent Corewell Health, one of the largest employers in the state of Michigan, and your previous experience has also been in senior leadership roles with other very large employers. Mm-hmm. And so with that said, what kinds of interventions or strategies have you seen be successful at the local level, and what would it actually take to scale those endeavors regionally to meet a more regional demand?
So one in particular that I could think of, at the time I was with Henry Ford Health System, all my friends out there, for a long time. That's my family. We went into a venture with 2 other healthcare systems, maybe back in about 2015, with the city of Detroit. Shout out to Nicole Freeman. We worked together on this project, but we collaborated along with Oakland University and did some wonderful work together as a region to hire for patient care sitters and patient care assistants. And back then, we were able to hire over 200 people by that collaborative effort, alongside with Oakland University that did the curriculum for us. So it worked at that time. However, it did not, it wasn't scalable for the organization, and so it kind of fizzled out. So it worked for then, but I would say for now, we need to come together not only as health systems, but also with our regional partners as well, our schools. I sit on the Oakland County Workforce Development Board. Hi, Jennifer. So all of those agencies, we need to come together to really put together something that is long-lasting. And with that, we have to put things together that will upskill our current population of employees, and then also reach out into that 500,000 people that you talked about that aren't employed, and bring them into the healthcare system as well. Another thing I would add too, for the generation that is coming up, we have to make healthcare look inviting, right? And appealing for our young generation. And I think we lost some of that in the pandemic. And so I think coming together, those would be some of the efforts that we will work on as a region.
Thank you. And Catherine, in your role at Henry Ford Health, you do live and experience a talent crisis every day. So how does that affect your operations?
Well, I think just like any other industry, and all healthcare is going to be the same. When we see a shortage in talent, you experience a shortage in staff, right? Which then leads to a shortage in appointments and unfortunately results in delayed care. And so For us, it's really about providing a safe place to work, a safe place to seek care. It's about providing opportunities for internal mobility and development. It's about ensuring that we are providing careers for life, so opportunities that allow us to grow our own talent as we bring in new team members. With over 4,000 entry-level positions in healthcare in our region, it's not just a Henry Ford problem, it's a regional problem that we have to get ahead of and resolve. And when I think about real development opportunities and the creation of pathways and partnerships with many of the people in this room, I'd be remiss if I didn't give my own shout out to the Macomb-St. Clair County Workforce Development Board. But resolving this issue is going to be more than just us coming together at a table. It's going to be collaborating in ways that we haven't before and really thinking outside of the box.
That's right.
So patient care is number one for us, and a culture of belonging and inclusivity within our four walls is something that we are dedicated and determined to instill.
Absolutely, and we're grateful for that. Mm-hmm. And Greg, taking us back to conversations that you and I have had some time ago, you've called out opportunity populations such as the immigrant community as really viable sources of talent. And so I'm curious, what are some innovative strategies that you've seen employers take on to meet their own talent needs?
Sure. So there's no substitute, though, for go back to that pipeline. We've got to get more students through high school into some kind of higher ed. Through higher ed. A lot of people think once people start higher ed, you can declare victory. You look at the completion rates at some institutions, we have a lot of work to do there. And in terms of all of us supporting students, we've made big strides in making higher education more affordable. The Michigan Reconnect that will allow adults to go back and finish an associate's degree tuition-free. The new Michigan Achievement Scholarship, which has really helped fill a gap. So the word hasn't really kind of trickled all the way down to the public yet. We all have a lot of work to do in communicating that reality. We also have to be creative and take advantage of populations that are there. So I have the privilege of sitting on the board of Global Detroit. They have a major initiative, the Global Talent Retention Initiative. Any guess here about how many international students attend a higher ed institution in Michigan at any one time? It's more than 33,000. And they are concentrated in STEM, and they are really under the radar. Global Detroit has created this initiative to kind of reach out to those students, introduce them to Detroit, to the state, and then create pathways to employment. Now, they are international students, so there's a lot of visa issues. I've heard at least 3 people at Mackinac so far this week talk about stapling green cards to diplomas, and directionally that's where we have to think. But there are opportunities for employers to tap into that population now. There's the OPT program that allows those students to work without an additional visa for a year. In some instances, that can be extended as far as 3 years. And we have a mechanism through Global Detroit. I see Steve, I think, and Elena Jackson can talk to you about how to take advantage of that. I think there's some hesitancy on the part of employers. I think people get nervous about visa requirements and the red tape. But Global Detroit is at least there to help you start that process and tap into that tremendous talent pool that's there. But another trend that I've seen employers start to take up lately, Accenture has worked with Henry Ford, created the Michigan Apprenticeship Network, and now there are employers that are looking to create apprenticeship pathways into professions that used to only be available to people with a bachelor's degree. So I think that's a growing group. I think Kendra Quinlan is somewhere here. She's in the back, but she can talk to you about that network. I think it's welcome to all comers that want to participate. But I think not just thinking about how do we collaborate with our existing system, but how do we look at pools of people that may have been overlooked, and how do we think about other approaches to upskilling the talent pool.
Absolutely. And Catherine, I'm going to kick this over to you because I want to recognize that the Chamber, the Detroit Regional Workforce Partnership, and others have a lot of ongoing work that is underway focused on healthcare. Why are they all important?
I think they're all important. I think bringing them all together is going to be it's going to be the difference maker. So I would like to also recognize our work with the University of Michigan and our ELAC collaborative, as well as the great work we're doing in building pathways and expanding our apprenticeship program. So I'm so pleased to be able to work alongside many in this room to allow for real career development from in jobs and positions that many people didn't know about before they entered, and really starting younger and earlier or sooner in a career progression than we ever have before. So our high school partnerships and our work with the CTE programs has been a difference maker for us. The NA to BSN and our partnership with Michigan State and allowing for advanced degrees in nursing is going to be a change maker for us as well and a difference maker. We have also invested greatly in recruiting. We've recruited from the Philippines for many times to help kind of address some of the shortages we had and just not having enough in the talent pool here.
Any similar or different responses?
Go ahead.
I would just add to that, the partnerships that we have allow for us to create new talent within our organizations, as Catherine mentioned. So, our partnerships with the universities, we have nursing programs where we're bringing in nurses into the organization. ELAC is another one, as Catherine mentioned. Our workforce development entities that allow for the Going Pro grant. Michigan Reconnect allows for us to subsidize tuition for colleges, and Corewell pays the rest for employees. So it allows for those initiatives. However, we do need more scalability. And that's why we're here today, to talk about that. We need more scalability in order to beat this talent crisis that we're in. It's not enough to fill our vacancies. We still have vacancies, even with all the millions of dollars that both Henry Ford Health System and Corewell is spending on those initiatives. It still isn't enough. And so coming together and really figuring this out as a region, to me, just empowers me, because I'm excited to see what that'll take us in the future.
I can feel the excitement. And what about for you, Greg?
Well, I mean, so an example about how do we kind of step from where we're at to what's possible. One of the things we learned bringing together this collaborative in healthcare was there are individual examples of career information that gets to high school students. But, when you look at 100 school districts and, a lot of healthcare employers and, this whole ecosystem of higher ed, it was very scattered and small. So we pulled together a lot of partners to figure out what was in place, realized that this is something that could be done on a much bigger scale. So I think it was a month ago, we brought all these partners together. We were out in Oakland Intermediate School District and started planning for a really large scale career fair, career expo for high school students, starting with high school, but thinking about how do we move this down to younger grades. It would be on the campus, of a higher ed institution that would rotate, but that we would be talking to them about what are the careers and where do you go to get trained in those. But we'd really scale up from kind of small pockets of things that exist now to one large regional career fair for high school students in healthcare, and then connectivity to where's the training available. So that's an example of kind of building on what's already there, but taking it to a much different level.
Absolutely. And so, not to be repetitive, but I think at this point we all agree on the importance of a regional employer-led approach to solving our talent crisis that actually builds upon the wonderful work happening within our higher education community, with our local workforce systems, and all of our community partners. And so from where each of you sit, why is it important to figure out how we put all these pieces together? Because there is great work happening, but how do you make it a more coordinated business-led approach?
Well, I think we're all taking responsibility and accountability for our part in it. And so, I'm going to build off of Greg for a minute as well. In addition to what we're doing in high school outreach and college outreach, we're doing the same within our own four walls. So we're inviting the universities in, we're inviting our partners at the table so that we can level up the level of communication and awareness of what is available and ensure that we're offering the services that are needed at the time in which kind of wraparound services are needed to really develop and advance. I'd also offer that it's important because if we don't, we lose the benefits of all of the great work that the people in this room and around the table, the multiple tables that we have really pushed to progress. And so I think that we all completely acknowledge and are aware that together is better. And so we really want to bridge that gap.
Absolutely.
And I would just add to that, as I sit here and I listen to Catherine, and I remember Bob saying that he's been in the nursing crisis for 40 years. And so And I've been in the nursing crisis for 25, so we're both dating ourselves for sure. But with that being said, I think, when we do get the opportunity to come together and really fix this, the question we should answer should probably be, what aren't we doing? Because we've been doing this for a long time. A lot of the things that we stated today have been in place for a long time, and it hasn't been fixed. And so I think that's an important question just to rest on the top of everyone's heads and minds. What is it that we're not doing to beat this talent war? And let's come together and let's fix it.
Absolutely. You, Greg?
So I'll go back to Bob talked about making the pie bigger in terms of the talent pool. And how do we get, especially if we want a more equitable workforce, how do we help students that haven't been well served by the system that we have or haven't been able to make their way through it? So one of the things that we've started to look at a regional level, but it can also be brought to kind of a healthcare collaborative is, how do we support students in higher ed who face challenges every day that sometimes, it's a car repair, it's a utility bill that means the difference between staying in school or having to go to work to pay some of those bills. And so thanks to investment that you actually made when you were at the Rocket Community Fund before you started this opportunity, we created the Detroit Area Talent Fund. We partnered with an outside entity to get emergency grants into the hands of students quickly to help them overcome challenges that might otherwise result in them having to drop out of school. So last spring, in actually a very short period of time, with almost no publicity, just reaching out through our networks through the chamber, so the adult population that we work with through our Detroit Reconnect, our Detroit Promise program, we let students know that this help was available. We gave out, I think it was about 1,200 grants in about 2 months, about $600 or so, that was the cap. But we've tracked those students. So the majority were from Detroit, not all, but we've tracked them. So into the fall semester, we know that 89% of those people that got a grant had either completed a degree by the fall or were still enrolled. Now, we didn't have a control group to compare them to, but we're very familiar with those groups, with the Promise and Detroit Reconnect and what the persistence and graduation rates are. We know that was a huge benefit to them. And as a result, now we're talking to other partners about a scalable response that would let us connect students who are vulnerable to resources quickly, both on their campus, but for campuses to connect to regional resources. And that's something that would be available to people in healthcare, training programs as well. So that's another example of, again, the pipeline. How do you get more people through it instead of just fighting for the people who are coming out the end?
Absolutely, and I was incredibly grateful to be working on that directly with you, Greg.
Thank you.
And so this is directly to you, Jan and Catherine. And so curious, what is working at Henry Ford Health and Corewell Health that you want to see grow and scale?
So I'm going to piggyback off of Greg a little bit and say that there is value in an earn and learn model. There is value in leveraging all of the resources we have to help remove the barriers to employment, remove the barriers to education. And we heard it in the panel before, as they were talking at the higher ed panel, as they were discussing, the opportunity really to get into what the job is going to look like prior to just graduation. And so there's great value in retention, and I think our work and our investment in our apprenticeship programs, our work and our investment in our community partnerships and relationships are all working really well. And we couldn't do it without our higher ed partners or our local school districts. So I'd say that those collaborations are working very effectively.
Amazing. And for you?
I totally agree with Catherine. I would just add, in addition to that, the Going Pro Talent Fund is one that, we received $1.5 million from the Going Pro Talent Fund, which allowed us to put in place several apprenticeship programs and the ability for us to upskill current employees within our system and then also community members. And we did that 50-50, 50% community, 50% within. So that in itself, along with our partners, are the universities that we partner with for talent pipelining, that is working very well. The Michigan Reconnect Fund, that is a wonderful program where our young adults have the opportunity to go to school for free. I mean, those programs really make an impact within the talent pool. But I still think there's work to be done. You know, there's always a good and a not so good, but it's definitely putting us on the right path to fight this crisis, for sure.
Yeah, couldn't agree more. One more question and coming in hot for the both of you. And you represent two of the largest hospital systems in Michigan. So I'm curious what your vision is for a workforce ecosystem that meets you where you are and delivers what you need, which is a much deeper supply of highly qualified, talented individuals.
So I can give you my dream, and I started telling you this yesterday, and probably about, I want to say 6 or 7 years, I shared this in a diversity council meeting with Bob, but my dream is that we have one talent hub within Southeastern Michigan, where all of our employers come together and we have one place where we service all individuals at the right place at the right time to make it easier for individuals to come in and to get trained and to also get employed. And we have all of our partners right there so that it's not scattered as it is right now. You know, I serve the entire state of Michigan. So I have partners in Southeastern Michigan and also in West Michigan. Now, the areas, the market is very different in both places, but it is, you know, difficult for us as employers to manage partners, you know, throughout the state of Michigan. I would love to have a talent hub where we all could be together, have one applicant tracking system, and utilize all of our talent. Also, we would also be advantaged with doing that, with breaking down barriers to employment. So much of what Greg talked about with childcare and the ability to earn while you learn is so very important, because there are a lot of people out there that can't afford to go to school without getting a paycheck. And I bet a large percentage of those people are a part of the 500,000 that you stated in the beginning of our conversation. If we can't pay them while they go to school, they're going to drop out if they can't feed their families, right? And so we need to uplift that within our community to make it more accessible for people to go into careers and not jobs.
I see a world in which we can actualize that vision, Jan.
Mm-hmm.
So you said it here. We'll check back in very soon because really important work is underway. So, Catherine, what's your vision?
I'm going to steal a little bit of what Jan said, but at the end of the day, my vision and my hope is that the communities we serve become healthier. And we do that by economic health, actual health, physical health, mental health. And the youth within those communities see a promise to a career within the community that we've built and see a future for themselves. And so my vision is that we will be able to offer services to allow people to develop into whatever they want to develop. And we offer opportunity unlike we have before, so that each of the communities that we serve really gets to enjoy and appreciate a healthy and thriving community.
Absolutely. And Greg, while you are not an employer per se, would love to hear what your vision is for a healthier, more collaborative workforce ecosystem.
Well, it's not just one thing, right? I think we have to recognize kind of what are the unique attributes of our region and kind of the demographics, the cards that we've been dealt, and how do we develop strategies, to maximize that. So you talked about a large population that's disconnected, from the workforce at all, and that's kind of that pipeline. Those students, if only 35 of 100, 10 years after they start high school, have some kind of credential, you've left a lot of folks behind that never even started. But the other unique attribute of our region is that we are really overrepresented in the percentage of the population who started higher ed but didn't complete. It's 22% of the population. That's almost 500,000 people in Southeast Michigan. Working age adults who started college didn't complete. And so, those are folks, many of them eager to upskill themselves, either with their, the employer they're with now, or maybe to go someplace else. And what can employers do to tap into that resource? So actually, a lot of our work in healthcare got started with a survey that we did with Henry Ford Health, the Bridging the Talent Gap survey, and that went out to employees who, were in kind of non-clinical roles and ask them, what are your interests? Do you have an interest in upskilling? And if so, what are the barriers? And then we use that information to, okay, what we found is a lot of them don't understand what those career pathways look like. We've worked with Henry Ford to create career pathway maps that let people, understand, how do I navigate to these occupations, and what are the training that I need? And now it's a question of scaling those things. There's a policy piece of that. We've talked about it, Michigan Reconnect. Now they can go back to college tuition free. Through Michigan Reconnect, they have navigators. We're in conversations right now to see, can we bring some of those navigators to to large employers that have these populations that might be served by, I'm interested in going back, I understand what the opportunity is, connect me directly to, not just kind of give me a piece of paper or send me to a website. Let me talk to somebody who can help me. So that's an opportunity that exists as well.
Absolutely. Before we get to a few questions, I think this maybe is an opportunity for a bit of a shameless plug for the Detroit Regional Workforce Partnership, where we're really organizing employers by economic sector and really simplifying how we actually collaborate to achieve this depth of talent outcomes, this depth of retention. And so I just want to take a moment to say thank you. Thank you for not only being here today and for your commitment to solving vexing talent challenges, but thank you for your belief that the regionalized employer-led solutions can and will be transformational for Southeast Michigan in ways that we've seen across the country. So thank you for your commitment. Thank you for being here. It is really important, and we're so grateful. I think now we can segue to questions. So thanks to the audience. First question is, how do we find the people in that 500,000? Those that are not yet participating in the labor force, whether they're disconnected from school, disconnected from training opportunities, how do we find them?
I would say, I'm going to go back to 2015. Nicole and I used to walk the neighborhoods of the city of Detroit, and we would go door to door and talk about programs that were offered by the city of Detroit. And that's how we filled up our programs for patient sitters and medical assistants that I spoke of earlier. You have to meet people where they are. And so the traditional ways of advertising, social media is a big plug now too. That didn't used to be years ago. But we have to think of, how do we reach the people that aren't looking, right? So those passive candidates that aren't looking. We also have to do a better job at in reaching those people, allowing for them to believe that they can be a nurse, believe that they can be a physician, believe that they can be all the wonderful things that we have in healthcare, because you only know what you know, right? When I grew up, my mother was a teacher, then a principal, and my father was a police officer. When I went to college, the only thing I knew how to be was a teacher or a nurse, because my aunt was a nurse, right? So I didn't know any other professions out there. And I remember my first job at Oakwood Health, I was in my 20s, and I hired a young lady the same age as I as a nurse anesthetist. I said, man, how did you know? I'm looking at what she was making, right? I'm like, how did you know to go to school for this? Who told you this, right? I could have done this, I think I was making like $13 or something, but it was good money, But she was making like $25 back then. I'm talking about the early 90s. And so you only know what you know, right?
Yeah.
And so I always try to, on a one-on-one basis, have conversations with people to say, hey, you can do this. You can be this. This is the pathway, And if we have more people out there sharing stories like that, and investing in people and believing in people, I think we'll have a greater outcome.
Just to build on that a bit, I think our community partnerships and our community relationships are a huge part of that. Another thing that we have invested greatly in and really have supported is our youth programming and welcoming not only our youth, but their relatives, their siblings, aunts, uncles, parents, grandparents, to offer an opportunity into what our career pathways look like. The career pathway maps have been a great resource in our high schools and our colleges, and even within our own internal career days. So we hosted our first at West Bloomfield Hospital last month, where we invited in a couple of the local universities and had our own team members who may or may not even be aware of some of the positions within our walls, and offer an opportunity for, if you're interested in advancement and development, then we can provide wraparound services to help you get there. And Greg, you mentioned it earlier, but that one-on-one connection for each and every team member, community member, student that comes about is so critical and so important. And so really starting early and welcoming into the community of our hospitals.
Absolutely. What are your thoughts, Greg?
Well, I think there's two huge obstacles to, I think, more of those people in that population connecting to either additional education or employment. It's transportation and childcare. I think those are things that the partnership is really looking at. Are there solutions, region-wide? I mean, I went back and looked at the records. It was a long time ago, but I think the Chamber first took a position in support of a regional transit system in like 1967 or 1968, and here we are.
Here we are.
But we have, it's a, geographically we have a huge region. We don't have an interconnected transit system, not fully integrated. So whatever we can do to increase the regional transit capacity to allow people to connect to employment or additional education is helpful, and and helping people overcome childcare barriers. I know people in my family right now that they've had a child, they want to go back to school, and they look and say, the cost of childcare, what it is, well, I can't go out and earn enough money to basically cover that, or I would earn so much less money, or I wouldn't make enough money to cover much more than childcare. So kind of solving those two things, I think employers have a role to play, particularly in the childcare, but solving childcare and transportation challenges, I think, would help bring a lot more people, into the workforce, and again, expand that pie.
Couldn't agree more. I think we'll end on one final question. So thank you for whoever wrote this, painting a future vision here. It's 2029. And as a result of our collaboration, what do we see? What's the result? Whoever wants to take it.
I think it starts with students graduating with much more exposure to careers in a variety of fields, healthcare, but others, and the opportunity to be exposed in high school, having kind of career pathway maps so they understand where do I need to go for what kind of training, that they're not channeled. I think we have to really, really differentiate between giving students, information to make decisions with, without telling them you need to go into the trades or you need to go directly into a four-year degree, but also making sure that they're academically prepared to make whatever choice they want to make when they leave high school. I think students graduating with credits from high school, so that they've already got dual enrolled credits, so they can transfer in someplace and already know that they've got maybe a year, 30 credits, 15 credits under their belt. That gives them the confidence to know that they can make it. It demystifies kind of the jump between high school and higher ed, so it's more seamless. But I think connecting all of those things, again, continuing, we've made huge strides in making higher ed more affordable, making sure that we don't backslide there. When the next time that we have a recession, there's going to be temptation to cut that funding for students that we've established. We need to make sure that we protect that. But making sure students have more information, they have the financial support to go, make sure that we've got more supports like the emergency grants that we talked about and that kind of infrastructure, but more seamless pathways into higher ed with more information on what they want to do.
Absolutely.
And then on the healthcare side, I think that we see higher household incomes in the communities we serve. And that's at the very core and the basics. I think internally we'll see increased internal mobility, advancement and development. I think we will definitively have more awareness into health careers and into the field, and a tighter connection to our education partners, and at the end of the day, increased retention.
And I would just add to that, because I'm saying yes to what both Greg and Catherine have said, but in addition to that, I would say that we have deeper relationships with pipelining for those that have criminal convictions, and also those that require accommodations, and also our veterans in the community where we have solid pipelining within the careers within healthcare. Also that our communities are vibrant and thriving, and Michigan is the best place to come live and work. And we have the ability to recruit people from outside of Michigan into Michigan to live within our communities. At the same step, we have also targeted that 500,000 that you're talking about, and we've engaged them into healthcare, and we've been able to sell to them that this is a great place to work, a great career for you and your families. And I would say most of all, on top of that, we have healthier communities. And so that's our aim, and I'm looking forward to it. So I'm ready for 2029, as you mentioned.
And if we close with how Bob opened, we will beat Boston as the healthcare destination.
Because Bob is very competitive,
Yes.
as you guys.
Listen, this is a competitive spirit, although this collaboration that not only we are fostering, but everybody sitting out that I'm looking at right now is a big piece of the puzzle. So we can't do it without you. We can't do it without the true collaboration that Bob was talking about at the very beginning. And we're incredibly grateful to be able to convene and collaborate in a really meaningful way that will be transformative. So thank you so much.
Thank you.
Thank you.